Hi, this is Dr. David Green with the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is the most revolutionary way to treat spinal arthritis, non-operatively. So here you have the back of the spine, and you have these spinous processes. These are the bumps that you can feel when you feel your back. Okay? On each side you have these thumbnail-sized joints, and you can sort of see them move on this model, and those are called facet joints, and there's one at every level on both sides. Okay, now they have cartilage just like your hip or your knee, and they are prone to developing arthritis as we age, and this could be from degenerative arthritis called osteoarthritis, or it can be from post-traumatic arthritis if you've ever been in an auto accident or a sporting injury or something where the cartilage in here got damaged. Now you might say to yourself, wow, those joints are tiny. Can they really cause that much pain? The answer is, oh yeah. Oh yeah. Because each one contributes to all this movement that we have. When you flex forward or backward or twist, these facet joints take a lot of stress, so they can be very painful. So what do you do about it? Well, what you don't want to do is say, you know what, I have a lot of pain in my back, let me just get this fused. But what are you going to do? Fuse the whole levels, all these levels here? If you have arthritis at one level, you probably have it at multiple, and you probably have it on both sides. So going to a fusion surgery is not the answer. Okay? One of the first treatments that can be tried, and I'm going to go beyond medications and physical therapy, chiropractic. I'm going to go to the interventional pain part of it. Okay? There are two different types of steroid injections that you can have. So let's say that the pain doctor looks at your x-rays, your MRI, and does a physical exam and says, you know what, I think the right side is hurting you more, and I think it's at these two levels, 3, 4, 4, 5. So they end up doing, a facet joint injection, which is steroid into the joint. That can provide weeks to months of pain relief. Okay, you could also tell the pain management doctor, aha, he got 90% pain relief for 6 weeks. I know that those two levels are the ones that are causing his pain. Okay, that's one way. Another one's called a medial branch block, and that's where the injection doesn't necessarily go into the joint itself, but it goes above it and below it. And the reason is as follows. You have pain in a joint, it's not necessarily from the cartilage damage itself. Okay, it is, but something has to tell the brain to feel pain. And there's little nerve branches that come off of these nerve roots that go to the joint from above and below. Okay, so if they inject around the joint that's arthritic, you can actually numb those nerves above and below, and that's called a medial branch block because those nerve branches are called the medial branches. Okay, now in and of itself, with numbing medicine and maybe a little steroid, those injections have been shown to be on average good to excellent for 3 months. Very long time in the world of just numbing medicine. Okay, now let's say it works and then it wears off. If it works well, then insurance companies will approve the most revolutionary treatment for spinal arthritis that we have, and that's called a radiofrequency ablation. So a radiofrequency ablation treatment involves going in the same areas, but instead of putting in numbing medicine, it gives a radiofrequency energy, heat that deadens those nerves above and below. And that's been shown to provide pain relief in over 80% of patients for upwards of 12 to 18 months. Very effective. And not only is it effective for the lumbar spine, it's also effective for the neck. And there are new studies showing that it can also be effective for the sacroiliac joints. Okay? And you can pulse it, and it's actually effective for migraine headaches, for up in the occipital nerve area. So it's been the most revolutionary treatment that we have. It's been amazingly effective. Okay, the board-certified, fellowship-trained pain doctors that we work with in Nevada is at Innovative Pain Care, and they do offer these treatments as well as over 25 others, such as nerve root blocks, spinal cord stimulator implants, medication management, a whole plethora of options so that they can be individualized to the pain that you're having. But in and of itself, radiofrequency ablation, which is also called RFA, medial branch neurotomy, radiofrequency neurotomy, however you call it, it's been one of the best treatments of the 21st century for pain management. Check us out on the web at painmanagementlasvegas.com. You'll find a lot of educational material as well as information about the doctors we work with and the insurances that are accepted. And there's 2 locations, Las Vegas and Henderson. I'm Dr. David Green with the Nevada Pain Network. Your pain stops here.